To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hi, and welcome to Your Health. Today I'm here with Dr. Andrew Scott from Echo Ridge Dental. Now at Echo Ridge, you guys do implants, you do sedation dentistry, also general dentistry. Let's talk a little bit more about implants and a little myth busting today. So there are lots of misconceptions. I'm sure you've heard lots of myths. What are some of the more common myths you've heard about dental implants? Maybe about how long they last, about healing time, all those things.
Those are great questions, actually, and I hear a lot of myths often. One of the most common ones is that you can just take all your teeth out and put implants in one day and you're done. And the reality is there are situations where we can put temporary teeth in the same day the implants are going in, but it requires a 3-month integration phase where that bone has to harden up around the implants for them to be strong enough to use to their fullest extent.
Gotcha. And then how about how long do they last? Are they permanent for life?
That is another great question. We used to say implants last forever, and a lot of people still think that. But the reality is nothing lasts forever, and nothing's ever as good as your original teeth. I would say implants are the next best thing compared to your original teeth, but they do require maybe even more maintenance than before.
Okay.
Yeah.
Now, I've heard of this all-on-4 implant. Tell us about it and your thoughts.
Yeah, the all-on-4 is a treatment concept where all the teeth are put and supported on 4 implants.
Okay.
In our office, we find that not to be enough. And there's an old saying among implantologists that all on 4, none on 3, which means if one implant goes south, then the whole thing kind of goes down. So we prefer to over-engineer using at least 6 implants, sometimes even 8.
Gotcha.
Yeah.
All right. Now, any risk factors that could affect the success of a dental implant?
There are a number of risk factors. The biggest one I would say is smoking.
Okay.
I've had a couple of patients who actually quit smoking at the time of their implant placement because we discussed with them that risk factor. Another one would be uncontrolled diabetes.
Okay.
For the diabetics out there, they know about their HbA1c number. It should be below 7.5. Gotcha.
And real quickly, let's talk about care after the implant. What should they still be doing?
Very important to take good care of the implants. They require professional maintenance with routine cleanings. And at home, they would use a water pick. Great tool.
Gotcha. Great information as always. Thanks so much, Dr. Andrew Scott.
You're welcome.
And thank you for watching To Your Health.
The preceding was a paid advertisement.